Hi everyone, I'm Michael Baltimore. This is Counseling Theory, COUN 6155. Today I want to give you some lecture information. Just spend a little bit of time talking about some important concepts that I think will sort of set the course for the things to come in this particular course. So here we go. Let's talk about first something called the therapeutic stance. Now, Frieda Fromm-Reichmann once said that the patient needs an experience, not an explanation. Now, one of the things that we have to do in our work is to set the atmosphere and norms that are conveyed in the very first session with the client. Clients will respond to your conscious and unconscious cues. If you are, for example, uncomfortable with your power in the relationship and compensate by being chatty, overly friendly, even unprofessional, your client will really treat you like a cohort and therefore not really set the stage for the therapeutic relationship to occur. So it's up to the therapist to set the climate for the client. Now, the therapeutic relationship is something that we have to spend a lot of time on, and I think it's very, very important that we understand that it is an alliance, and the alliance is defined as two parties who are sharing a common goal, who are mutually defined direction. So with a mutually defined direction, they're sharing a common goal, and this is a joint commitment between two people. Now, one therapist put it like this: you can view one of your primary therapeutic responsibilities as the consistent offering to you and to your clients of what might well be the first caring, non-exploitative relationship in their lives. You'll have taken, if you do this, you'll have taken a major step toward clarifying your therapeutic role. Another person put it as blending what you know with who you are. Now, let me give you a couple of examples from some famous therapists here that I think will help you understand this process of building a therapeutic alliance and the difference between some of the theories that you'll be studying in this course. For example, Bowlby. John Bowlby is famous for writing about attachment, those first 18 months of life where a person really begins to understand and formulate their personality. Very much akin to object relations theory, which we'll talk about more in the course. Now, attachment is very important because it allows a person to really establish a relationship for their first, in the beginning parts of their lives, even the first relationship with a caregiver, that allows them to what becomes what Bowlby calls a secure attachment. As a matter of fact, he wrote a book entitled A Secure Base, which really says that people develop their personalities and their ability to build relationships with others through the connections of trust. And so here, let me tell you what Bowlby says here. He describes the therapeutic role, and he says that the therapist becomes an attachment figure, providing a secure, trustworthy base from which a client can explore and reassess their working models of attachment figures. Now, if you think about that for a minute, there's this safe therapeutic environment that allows a person to really begin to explore different behaviors in their environment, gives them a chance to try some things out, and it can be done first in the therapeutic environment. It's a very important idea. But further than that, Bowlby begins to say that we become an attachment figure for those clients coming in. Now, let's take a look at another person here. This is Irving Yalom. Now, Yalom wrote a number of books. He's an existentialist in terms of his theoretical orientation, but he's also written some wonderful books about group psychotherapy. Now, Yalom says this. He says that the therapeutic relationship is a model which teaches the client what they can get from others. Isn't that an interesting notion? Well, let me throw out one more person for you here, and this is Carl Rogers and his view, by the way, one of the theories that we'll study quite a bit in this course. Now, Carl Rogers says that the therapist should find ways to offer themselves fully to the therapeutic relationship. It is this basic desire for the human connection. To hide behind a professional facade teaches the client at an unconscious level, don't be free in this relationship. Do not express your feelings or thoughts. It might be dangerous. Now, sometimes we talk about the term limit setting in a therapeutic environment. And of course, it has new meaning in this type of relationship. And it applies to what Yalom calls the ultimate rescuer. Now, in this role, this was something that Yalom wrote about in 1980, and he talked about this notion that what really happens is that clients come in with an unconscious hope, not of learning to be completely self-responsible, but of having you rescue them from the pain and isolation. Now, they may seek in you what he terms the ultimate rescuer that their parents, their spouses, their friends, and others have failed at being. Now, the word of advice here is that as you become the rescuer for the person coming in to see you, you will fail at this role as well. So it's very important to acknowledge your limits regarding what you can do and who you can be in the relationship. Now, this is an isolating moment, but it's also an illuminating one as well. The ideal therapeutic relationship is one in which the therapist is committed to being fully present, to offering the best of who she or he is, and also unashamedly offering realistic limits. Let me repeat that if you don't mind. The notion of being the ideal therapeutic relationship. The ideal therapeutic relationship is one in which the therapist is committed to being fully present, to offering the best of who she or he is, and also to unashamedly offer realistic limits. So let's move on and talk about the therapist's responsibilities. We've talked about a number of different viewpoints of what the role of the therapist is so far. We mentioned the therapeutic stance, this notion of building an alliance for eventually building a therapeutic relationship. But let me offer 3 responsibilities here for the therapist. Okay? So let's go down through this list. Number 1, the first thing that a therapist is responsible for is clear therapeutic priorities. It's simply stated, you are responsible for helping the client. That's your function. Now, here's a question that I often remind beginning therapists of, and I want you to remember this question. This is a very important question in any of your work at any moment in the therapeutic relationship, and that is simply this: will it help this client at this time? Is what I'm about to say or do in a therapeutic relationship, will it help this client at this time? And if you use that question every time you're about to engage in conversation with the client, it's going to help the process, because this is your responsibility to set the therapeutic priorities. Now, number 2. Number 2 is the emotional availability. This process that you provide your emotional being in this client and therapist situation. The client needs to sense that your understanding and support is there, and in order to feel safe enough to risk. It's really about your being trustworthy, your emotional availability. And then finally, of the therapeutic responsibilities for the therapist is objective assessment. This is a notion that you offer your objectivity to assess clients' behavior, their moods, and the thought process that they present. You have to diagnose, you have to plan effective treatment, and you have to evaluate that treatment. Now, there are problems with this, and sometimes we can identify too closely with a client. If you identify too closely with the client and take on the client's view of the world, you're accepting their renditions, sometimes of blame, of hopelessness and helplessness, as the absolute truth. Some of the therapists call this a fused relationship. Now, let's move on. I want to give you the fourth idea here in this responsibility, and that is the therapeutic knowledge and skill. You bring to this process your training and understanding of human relationships. So you must gain a thorough grounding in theory and skills that are helpful and that are up to date to help the clients. And soon it becomes second nature. Now, sometimes there's things that happen. The appropriate guilt notion somebody mentioned, realizing that the therapist has not helped the client, this feeling that you've just not done enough. Coming to terms with new and opposing information. These are the kind of things that therapists have to work through, and we're certainly going to talk about this in this course. Now, the fifth idea of the therapeutic responsibilities is self-understanding. Now, self-understanding is simply an awareness of one's own biases that you bring into the relationship. There's the rescuer role that we talked about earlier, this notion of becoming the person that's really going to rescue the person out of their hurt and pain and isolation. Sometimes the therapist may have a sense of urgency to help make these sweeping changes for people. It may be that you have to really begin to look at how the timing of your work is important. You know, sometimes clients come up with these a crisis situations which you have to respond immediately, although we know that some of these problems have been going on for almost a lifetime in some cases. Some of the things that you have to understand in this process is your own family of origin background. These are the kind of things that set early family patterns into play for you in your adult relationships, and certainly what happens in your family of origin is affecting who you are and how you carry out therapy. All right, well, let's move now to looking at client responsibilities, because we just reviewed what the therapist does in the relationship, and now let's take a look at client responsibilities. So first, what does the client have to bring? Well, number one, they have to bring an openness to help. And this is the notion that trust cannot be forced. For the therapist, you have to think of this notion of what it's like to be on the other side, what it's like to be in the client's shoes. This notion of openness to help, being open to that process. Number two, the exploration of affective issues. The client and therapist cannot retreat from this. And sometimes it's negative, sometimes they're very emotional reactions, but the therapist needs to respond spontaneously to this process to set up that helping relationship and that trusting environment. Finally, number three in the list of client responsibilities is the willingness to make behavioral changes. You know, what you have to do ultimately is to put into play on the outside what has been learned in therapy. It really is about taking risks, this risk-taking change that occurs when someone learns a new behavior and starts out to change relationships and other parts of their lives. All right, those are very important concepts. This notion, this list that we just went through of the therapeutic responsibilities and also the client responsibilities. I want to leave you out of this mini lecture with the notion of what I think is very, very important guidelines that you can use in your early session. So I have a list of these, and I want to go through, and I think there are 8 of these. So let's just take a moment. These are important guidelines, and these will help you as you begin these therapeutic relationships, both as you start your practicum and even after you've graduated the program. So let's run down this list. All right, number 1. When in doubt, listen. I had a case for supervision some time ago when a person was going down through a checklist, like a psychosocial list of questions, and when they got to the end of the list, asking the person questions like, what was your childhood like, have you had hospitalizations, different things about their family, and they ran out of the questions. They got to the end of the sheet and they said, well, what do I do now? I remember in the session, I was behind the mirror watching this person seeing the client, and it was she turned to the glass, looking at me for almost looking for help in that process. What she had failed to do was really listen to what the client was saying, because as this client talked about their father, their relationship with their children, the other members in their family, and out in the community, there were so many questions that you could ask about. When you get to that point where you're stuck in a therapeutic session, one of the guidelines I think is most important is simply to listen, because that's going to spark this list of new questions. And one more thing I would add to this notion is that you become and maintain curiosity about the client. The more you do this, the more questions you're going to have in terms of building that relationship. All right, number 2, interact unapologetically. Your best qualities need to be available to you during the counseling session. Let me say that again. Your best qualities need to be available to you. And really, you should not act impulsively or rush to treatment, rush to questions, but really, if you're honest, you're being yourself, you're in the moment, as we'll talk about more in this class, what I'd like you to do is really bring the best qualities you have to help that client. Now, number 3, offer appropriate hope. The client's expectations are going to vary from those who need to be rescued, as we talked about earlier, to those who are very common sense and want a practical response from you. I think you have to listen analytically. You have to paraphrase and rephrase things that clients say. But I think at the end of that first session, one of the things you have to do is, by all of the work you've done during that hour, is to let the client know that there's help for them. And that will establish this notion of hope. All right, number 4, negotiate when possible. There's a give and take that really is a reflection of mutual respect. This notion that you're not sure about some things and you're going to ask for clarification. You can ask questions like, this is what it sounds like to me. Is that what you said? Or does this fit your understanding? And really, this part of negotiation is really the mutual respect piece, that you don't have all the answers. You're not really sure of all of the things that a client are saying, but you're really going to negotiate and understand and come to an understanding of it. Now, this next one is probably one of the most important guidelines that you'll use throughout your therapeutic career, and that is simply this. Very hard to do, simply put, and that is mix empathy and challenge. Some beginning therapists convey, after they have started the therapeutic session and they empathize with the client, and they get to a point where they say, okay, the fun is over, and now let's get down to business. Challenging the client to do more is not in contrast to empathic understanding. Now, mix empathy and challenge really means that there's an expectation for you, the therapist, to do both of those. The supportive side, the understanding and caring side of entering into the client's world is very important. But also, the same is true about challenge. There's sometimes you have to ask the tough question. You have to go in and say these things that what you'll find out later is that the client is really expecting to be challenged. Now, the best therapists I know do both of those things. They show their caring and empathy, but they also can set limits, and they can challenge the client. So always find a balance between empathy and challenge. Number 6, Set concrete limits where appropriate. Non-punitive and matter-of-factly, but sometimes you just have to say what is going on, what is right. Set concrete limits. And you'll find this will be a very difficult task for you at the beginning, but it'll get easier as time passes on. Number 7, ally yourself with client strengths. If you identify and align with the healthy part of the client personality, you will refuse to collude with their psychopathology. This notion is part of the therapeutic alliance. You really are looking for strengths. You know, a lot of our training, especially during the training I had, was really becoming a problem solver, a person who focused on problem. We were very problem focused in lots of the therapeutic theories and training that we had, but sometimes we do that at the point of really missing the opportunity to look for strengths with the client. And I think that's very, very important, that we spend time aligning ourselves with the strengths of the client. All right, so finally, here's the last one. Indicate a willingness to learn. Now, you might demonstrate appropriate humility at this point. Ask questions. It's not that you should know all of the answers. You might become an expert on therapy, but the client needs to be the expert on themselves. All right, so there are 8 guidelines for early sessions, and I think some of them hold through even after those early sessions for a long period of time. Well, I want to thank you for paying attention to this lecture. This is important material. You'll see it again, and thank you for the opportunity of allowing me to share with you some of the important concepts in counseling theory. And very soon we'll begin to look at the actual theories themselves. So thank you for paying attention, and I'll see you next time here in Counseling Theory, COUN 6155.